So thank you all for joining us, the New Pride Agenda in Amida Care, for our virtual town hall all about PrEP, zooming to you live from Upper Manhattan. My name is Ahmed Mohamed, he, him pronouns. I head up civic engagement, public education at the New Pride Agenda, a nonprofit education advocacy organization whose mission is to set and frame the new policy agenda and focus areas for queer communities across New York State. April 10th marked National Youth and HIV Awareness Day, a time to focus on increasing awareness, generating conversations, and spotlighting the work being done to reduce HIV among young people. In recognition of this important day, today's event has a special focus on youth and HIV prevention. Young people must have access to the information and tools they need to reduce their risk of HIV. Schools have a crucial role to play in teaching young people about taking care of their sexual health, gender identity, preventing HIV, other STIs, and facilitating access to HIV, other sexual health and well-being counseling. Before we get into it, and I ask the panelists to introduce themselves, their pronouns, and a bit about their work as it relates to HIV, comprehensive sex education, or PrEP, we have a special guest joining us to give some opening remarks. New York City Council member Mark Levine represents the 7th District in Northern Manhattan, serving as the chair of Council Committee on Health and as a member of the Progressive Caucus. He is a leader on many issues, including housing, education, economic justice, transportation, environmentalism, and much more. We are so thrilled to have the council member joining us. So without further ado, council member, the floor is yours.
Well, thank you so much, Ahmed. Thank you to the New Pride Agenda for focusing on this urgent challenge. And I'm really thrilled about the panel today and about the great organizations, Amida Care, Callen-Lorde, Harlem United, New York Civil Liberties Union, that are stepping up in this fight. And I'll tell you, for the last year, we have understandably been so focused on this pandemic that I fear that the city has not been paying enough attention to existing public health crises that we may have slid backwards on in the past year. The kinds of public health crises which do impact people on the margins in this city, people who are often neglected by the mainstream medical system, people who are confronting the challenges of racism, homophobia, transphobia in life more generally. And I fear this could be a setback for our work, for example, in battling overdose, the epidemic of fatalities from opioids. I fear it could be a setback in a fight against viral hepatitis. And I'm also worried about the impact in our fight against HIV and AIDS. And we're really lacking good data so far that I think would confirm just what the situation is during this pandemic year. But all of us have many anecdotal stories, and I think we all have a sense that it's time to sound the alarm on this. And so I really want to commend New Pride for bringing us together today to focus on this. What we do know, even pre-pandemic, because really 2019 was the last year that we had data, is that while big picture, we continue to make enormous progress in ending the HIV epidemic, that there are certain subgroups that we're not making enough progress on. And that unfortunately includes young people, where we saw in ages 13 to 29, and in the year 2019, there were 700 new HIV diagnoses. In the year 2019, 32 deaths among that group. And unfortunately, particularly disproportionate impact among young Black men in New York City, as well as young Latinx and trans New Yorkers. We've got to focus on young people. And so I'm grateful for New Pride bringing us together on this topic. And access is a perpetual challenge, but also we have to do more to arm people with the facts, to educate young people, beginning at a very young age. I would say even beginning in elementary school, that sex ed in New York City must be expanded, it must be strengthened. And I would argue that the younger age is the ideal time to have these conversations, because it actually might be less awkward. People might be more awkward once they hit their teen years. And there's a lot of education we have to do around PrEP. I think you have a panel later in the discussion about the myths. There are many myths and misconceptions about PrEP, about it possibly disrupting hormone treatments, about its impact on sexual drive, and about its impact on the need to use other prophylactic safety measures. And so let's do more to get this information out to people. I think this cause is more urgent now than ever as we come out of this horrible pandemic. And I'm really proud to lend my voice to this fight as chair of the health committee, as a council member in Uptown Manhattan. And I'm really excited now to hear from experts. I want to get a shout out to my dear friend, Cynthia Demise, who's on here, one of the founders of New Pride, someone who I adore and who I really salute for her leadership on this issue and so many others. So I'll turn it back to you, Ahmed. Thanks again, everybody, for being part of this great discussion.
Thank you so much, Councilmember Levine, for setting the tone, establishing the urgency for this discussion. I'm sure we're going to have a very engaged, lively discussion. As I mentioned, today we'll be talking about PrEP, HIV prevention, comprehensive sex ed. And I'd like to give an opportunity for the panelists to introduce themselves, their pronouns, and a bit about their work as it relates to that topic. Aliyah, do you mind starting us off?
Sure. Good afternoon, everyone. My name is Aliyah Ansari, she, her pronouns. I am the teen health strategist for the New York Civil Liberties Union. Very brief, a little bit about my work. Before I even came to the New York Civil Liberties Union, I was a sex educator in New York City, teaching both middle school and high school students comprehensive sex education. So a very big proponent, very big advocate for comprehensive sex ed. Now I work a lot around educating young people about their rights to confidential health care, as well as advocating for the comprehensive sex ed bill right now that's actually in, in the, Congress as of right now, like in New York. So very big, like I said, proponent of comprehensive sex ed, and very much believe that there is a connection to comprehensive sex education as well in HIV prevention.
Awesome. Thank you for joining us. Alister, do you mind going next?
There we go, sorry about that. Good afternoon, everyone. My name is Alister Rubenstein. My pronouns are they, them. I am the Trans Health Program Manager at Amida. This is Wiley, he always joins us. His pronouns are he, him. Sorry for the distraction. So Amida historically is an HIV special needs plan providing comprehensive care coordination for people living with HIV or placed at high risk for HIV. Now, as of 2017, we're able to open our enrollment to folks that are HIV negative. So that's how I really became involved with this work in HIV prevention and PrEP, and that really looks like providing education to all of our members about PrEP and PAP, that they have coverage, providing HIV risk assessments and treatment adherence counseling if people are having a hard time taking our meds. And we are seeing, we have some preliminary data, which is exciting and showing that these interventions do work when you provide education. People start taking PrEP. If they're having trouble, they'll can be compliant with proper comprehensive supports that address all of the social determinants of health, which is what I think Amida is really great at doing. So really honored to be here and looking forward to today's discussion.
Thank you so much, Alister. Dr. Sandling, do you mind going next?
Hi, everyone. My name is Dr. Marcus Sandling. Pronouns are he, him. So I'm the clinical director for sexual health for Callen-Lorde. It's a community health organization that has sites in Chelsea, Brooklyn, and the Bronx. So I do a lot of sexual health, a lot of PrEP, and we've had kind of like a long service in Callen-Lorde in terms of working with youth through some of our programs, including with sexual health. Thanks.
Thank you so much. And last but certainly not least, Dr. Antonios, do you mind introducing yourself, pronouns, and a bit about your work?
Hi, my name is Vera Antonios. I'm the medical director at Harlem United, pronouns she. I have been at Harlem United for 10 years. I'm an internist and infectious disease specialist. I also do addiction medicine. So I encounter PrEP from different angles. At Harlem United, we have several programs that can assist people from testing to connection to care to health services, providing PrEP. We also have the HIV work that we do, so that goes hand in hand, making sure as well that people are taking their medication and are suppressed, and both ways would work to decrease the spread of HIV and the drop in new infection, which are the goals of ending the epidemic. So I'm excited to be here and to join this conversation.
Thank you so much. Before we get into the discussion and start learning, hopefully, I wanted to establish community agreement. We want this to be a safe and welcoming environment. So we ask everyone to practice mutual respect. We hope that you guys are engaged and encourage you to use the chat and comment features, or even raise your hand if you want to make a comment, but ensuring that you're being respectful. Everything that's shared here is confidential, and we use I statements when we're sharing things from our perspective. So with that said, we can go ahead and dive into the questions. And I think it's good to level set a bit for folks in the audience who may not know what PrEP is. So Dr. Sandling, do you mind just establishing what PrEP is? How does it work? Why is it special, and why are we talking about it?
Absolutely. So PrEP is 2 out of the 3 medications we typically use to treat people for HIV, but they found that if you take it consistently prior to exposure, it can greatly reduce your risk of acquiring HIV, even in what we consider high-risk sexual circumstances and otherwise. So it's a medication, we prescribe it, we would check you for HIV and other STIs prior to starting, and follow you over the course of time while you're taking it.
And it's a once daily pill, correct?
Yes, once daily pill, exactly.
Awesome. Thank you. I would like to come to you next, Dr. Antonios. Given your long history of working on HIV research and care in Upper Manhattan, how would you assess the community's progress and PrEP uptake? What are some of the challenges that we see persisting, potentially some solutions or ways to address those challenges?
So I want to mention that in New York State in general, we have made a lot of progress in increasing the number of people on PrEP. As of 2019, there was about over 67,000 people on PrEP, which is great to hear. We still see the discrepancies in terms of who is on PrEP and which population is at risk of acquiring HIV or who had the new infections. So our work in the community in Upper Manhattan has been on different levels. We have seen some increased awareness, increased uptake. However, we know that there's still a lot of work to be done. I want to talk about, what has been done and, what we do to help spread the word and help raising awareness and acceptance of PrEP in the community. So Harlem United has a testing program that is offered to everyone. It's for free, HIV, STI testing. People don't need an appointment. They can be connected to benefits and insurances, so they can be helped to navigate how to get those, and then connected to a provider. And usually that could happen within the same day to get access to PrEP. Or to discuss what we call PEP, which is post-exposure prophylaxis, which is when people are, have been recently exposed to HIV and they have ways to protect themselves, if that happens within 72 hours. So That program has been essential in raising awareness, spreading, education, and connecting people to care. So that is one aspect of what we do. The other aspect is definitely working within the clinic with medical providers, making sure we educate and we encourage providers to look into their unconscious biases and making sure that they are comfortable talking about, sexual behavior and practices. They're comfortable asking this on a regular basis, and they're aware, and they encourage their patients, by discussing these options that are available to them. So sexual history, substance use history are part of a routine medical visit. That's how it should be. And at the same time, campaigns and marketing around PrEP and participating in PrEP awareness events. So with all of this work, we do see that the numbers have been improving. I think we could do more and we could do better in that. The numbers of youth are still lower, and the number of people of color and women are lower than the rest of the population. So we definitely still have work to do here.
Thank you. Thank you for distilling that so clearly. I want to come to Aliyah and Alister, but first, Dr. Sandling, can you talk about some of those challenges that relates to increasing access to PrEP, particularly for youth and communities of color, maybe access challenges and some solutions that you guys are seeing at Callen-Lorde?
Yes, absolutely. Now that we have this great medication that can drastically reduce the risk of people acquiring HIV, how do you actually get it from the drug company into the hands of people who need it most? And as seen in recent data, there's been markedly increasing risks of HIV acquisition, as well as, unfortunately, really severe complications in the brown and Black communities and people who are underserved and people on lower income in the United States, just like Congressman Levine was discussing. The biggest issue some of the big issues that we see come from understanding from the patients that this is something that's available to them, understanding how it works and feeling as though something that they could benefit from, access in terms of access to medical care, access to financial resources to actually pay for the medication, as well as an infrastructure that helps to deal with all of the things that outside of actually just physically getting the medication. Someone has to deal with the medical visits, someone has to deal with the labs, the STD screenings, keeping someone on a schedule, getting to the actual doctor's visit. So there's a lot of logistical challenges that happen that sometimes get missed when, sometimes funding just goes specifically for medication. There's a lot of things, and that just has to do with the setup of the healthcare system, unfortunately. So.
Thank you. Thank you for also discussing those social determinants a bit. I'd like to discuss those more in a second. I also want to define this idea of comprehensive sex ed. And for that, I want to come to you, Aliyah. This is an important tool in combating HIV in youth, looked at as a comprehensive sort of root approach. And as Councilmember Levine was alluding to, has shown in some communities to be more successful than later intervention opportunities. And so can you define it for us, for folks in the audience who may not know what it is? You mentioned your work in support of a bill currently introduced in Albany in the legislature. So maybe perhaps a bit about what that would do for kids in public schools throughout New York.
Absolutely. So first off, what I want to say is that comprehensive sexuality education is health education, and it is important education. I think that there's a lot of misconceptions about comprehensive sexuality education and how it should be taught. So in a nutshell, comprehensive sexuality education is education that should be in grades K through 12. It's medically accurate, age appropriate. So every lesson is based off of developmental development, childhood development, as well as age. So age appropriate as well as inclusive, not just in a run-of-the-mill lesson on like LGBT pronouns, which sometimes some sex education does, which is not inclusive at all, but is actually intentionally inclusive within language, anatomy, everything, right? It also encompasses a wide range of topics such as human development, which includes puberty, reproduction, sexual orientation, as well as gender identity. We talk about relationships, which include both romantic and sexual, as well as friendships and family relationships. We create increase personal skills like communication, and negotiation, as well as decision-making skills, as well as sexual behavior, which people kind of put comprehensive sexuality education as just about talking about sex, but encompasses a whole bunch else, a whole bunch more, right? It also equips people with knowledge and skills to make informed decisions about their bodies, about their health, and about their relationships with other people. I think it also a really key point too is that it helps to for people to delve into their own personal attitudes and values surrounding sexuality, as well as relationships, but also to foster an environment of respect of others' attitudes and values. And like I said, the key point too is that it helps to empower young people, but anyone that wants to deal with learn about comprehensive sexuality education or takes a comprehensive sexuality education class, it helps to encompass that. Yeah, I think I don't want to be talking too much on it, but as you can say, I can talk a lot about it. But I think that's pretty much as small of a nutshell as I can get about what comprehensive sexuality education is.
No, that was very detailed and clear. I think it's evident how passionate you are about it. I was going to ask, so if this passes the legislature, and I want to also know NPA is a huge supporter of this bill. And so our advocacy arm does a lot in trying to get it passed. We're hiring a new executive director, our first in July, hopefully. And so that leader will also be pushing that charge forward. And so hopefully this will be a continued partnership, Aliyah, as we get this bill passed and comprehensive sex ed in schools. But I guess the question is for folks in the audience, the bill passes and then kids throughout New York State, statewide, right, public schooling would have access to this comprehensive sexual education. Is that correct?
Yeah, so it would require both public and charter schools to teach comprehensive sexuality education. And it would be from K through 12. But like I said, once again, stressing the age appropriateness. Because what we've seen a lot is a lot of different news articles, providing disinformation about what kindergartners would be taught. And so it's very much based off of national guidelines, national standards of what comprehensive sexuality education is. And so very much age appropriate, medically accurate. And so really hoping that this bill can get passed because a lot of young people deserve it. And this also ties into how it can help with HIV prevention as well, because education, I think, is number one when thinking about how to prevent HIV.
For sure. And I think you hit it on the head when you said empowering kids to make informed decisions about their bodies and relationships. And I think those decisions are what lead to an end goal of preventing HIV in youth. Alister, I'd like to come to you. So we're having this conversation about HIV prevention, a little focus on youth. Of course, there are also youth of transgender, non-binary, non-conforming experience, but then generally for that community, can you speak to some of the challenges we see in getting folks on PrEP from that community and maybe dispelling some of those myths that we alluded to earlier as it relates to hormones?
Absolutely, thank you so much. And thank you for what you shared about inclusive sex ed, because I think that's really where it starts. If people don't see themselves at risk, if they don't understand consent and body autonomy, they're not going to seek out these services. And for a lot of, trans youth, they don't have family support. They don't have a lot of guidance to, direct them to these services. So, I know a lot of places do outreach efforts that are peer-led, which can be very successful, but, it's so hard to get trans people, just to the door of the doctor's office. And then what happens, when they get there, you can have a trans affirming provider, but you need to get through a lot of people to get to that doctor. And if it's, it can be very, traumatizing if the care isn't gender affirming and trauma informed and comprehensive to address all the other issues that may be going on. If someone is homeless, they're not worried about taking their PrEP meds. We need to address all of that in order to, increase the uptake, of PrEP. We're trying to do right now, we're almost complete with, we have like an app, so you can do a self-assessment, which I think could be very good to make it more accessible for youth who maybe don't want to have it's telephonic, it's very limited. So we're trying to figure out how can we increase access and make sure everybody just knows what is PrEP, what is PEP, what are things that put you at high risk for HIV, because I think a lot of people just don't know. And then the other big thing with the trans community, when we looked at our data as to the reasons why people don't take PrEP, even though they're considered to be placed at high risk, most of it was side effects, but didn't stay on it long enough for those to pass. And then also concerns about interactions with hormones was the other top thing. So we're working on educational outreach campaigns to help dispel some of the myths and the rebuttals of why, when we did HIV risk assessments, why are people saying no to PrEP even though they could benefit? Why didn't they start taking it even though they said that they wanted to? So another big challenge is just, data and knowing what works and having a model of care, that's effective. That's why I think it's so important for all of us to come together and to talk about, what we're doing and how that aligns. So thank you for organizing it. It's great.
Of course. Thank you for outlining that. So clearly, you talked about an app, which also inspired some questions about, I got a text, I think the other day, from a LGBTQ health service provider, and they were talking about virtual PrEP or getting access to PrEP virtually. And so we've seen, because of this last year of telemedicine, a lot of things that have come into fruition that we never thought could exist, like telemedicine. And so I guess this is a question for anyone who wants to take it, maybe multiple perspectives. What are some of those lessons that we've learned from the past year that have improved access that we would like to hold on to as the world does eventually open up and folks are seeing each other more regularly in person?
I would say, yeah, the benefit of this period is that it taught us, the advantages of telehealth and how we can utilize it in various aspects of care. PrEP is being one of them. Patients who needed to continue on PrEP or to start PrEP, they could have telehealth visits. You want to make sure the conversation is there and it's not affected by the fact that you can't see them in person. At the same time, you want to make sure you facilitate the tests that they need to get on a regular basis. So blood test, HIV test, STI testing, and we've used different ways of doing this. There are at-home kits that people can get access to for HIV testing. We were also having a home blood draw for when people could not go and get tests. So there are different ways that can be facilitated, and I think we should consider holding on to some of that because it definitely makes it easier for people.
Thank you. Anyone else would like to add to that, or?
Yes, this is Dr. Sandling. I just wanted to agree that we've been able to, connect with a lot of patients, add more flexibility, and still maintain pretty reasonable standards of care in terms of monitoring patients during the COVID-19 pandemic while utilizing telemedicine. Obviously, there are a lot of things that will make it complicated as we come out of the pandemic. Regulatory changes, billing changes, people's insurance are not always as amenable to just going to whatever labs available. So some of these things, need to be worked out at the state and federal level to facilitate this for the patients. But I've had lots of patients who been able to utilize this and continue on PrEP and continue to have this extra layer of protection through this kind of complicated time.
Yes, thank you. I want to go to an activity that we have for members of the audience to hopefully reinforce this knowledge. But before, I'd like to read a comment by Zakia, who says, a lot of public education must be priority in communities, including educators. We must ward off the fear mongering and false information. This is too important for children, young people, and Black and Brown communities to not be able to access. And I think that statement holds true for both general PrEP increasing access uptake, but also comprehensive sex ed, and how the two work closely in tandem at achieving that goal of eradicating HIV and hopefully eliminating it in our youth. And so if we could open up the poll, I know that we have a few questions that we would ask folks in the audience to just answer, true or false. We'll give you guys about 45 seconds to fill out this poll, submit it, and then afterwards, myself or the panelists and myself will take one each. We'll get out the right answer. Hopefully we'll have a little fun activity to reinforce this knowledge that we just learned. And I think, because I just submitted it, after you submit it, it'll disappear. But when we show results, we'll be able to see how everyone fared in a sec. So 15, 20, 30 more seconds. We'll give folks get through it. Alrighty. So I think we see the results now. Is that true for everyone? Yeah. Okay, awesome. So I'll take the first one. PrEP makes individuals more promiscuous. True or false? This is indeed false. Nothing in PrEP makes individuals more promiscuous. That is fully a myth. And so you should not feel worried about your sexual activity being impacted if you were to take some PrEP. Alister, do you mind taking the second one?
Absolutely. So true or false, PrEP can interfere with hormone replacements. So this one is false, like we just discussed. Their studies show that there are no significant interactions between hormones and PrEP, but definitely always encourage folks to have that conversation with their doctor.
Awesome. Thank you. Dr. Antonios, do you mind taking number 3? Once you start PrEP, you can never stop. True or false?
So that's false. You can always stop PrEP if you are at a point that you feel it is no longer needed. It is recommended that people continue taking it on a daily basis. One thing to remember, and this is something when we evaluate people for PrEP, we check for hepatitis B, just because the same medication that works for PrEP work for hepatitis B. And if people do have hepatitis B, we don't want them to stop the medication abruptly. So they should communicate with their doctor if they are stopping. But again, the recommendation is for people to continue taking this on a daily basis, but people can stop when they can. There's no other, beside that situation.
Awesome, thank you. Number 4, Dr. Sandling, I can take PrEP only on the day I know I'll have sex. True or false?
So that is false. So PrEP should be taken daily for a period of time before sexual activity, so it can build up protection. However, there is a newer strategy called PrEP on demand, where you can take it at the time, shortly before sexual activity and for a couple of days afterwards. Either one of these strategies are viable as long as you take them as prescribed.
Awesome. And I highly encourage you to follow up with your local physician or primary care facility to learn more if any of this interests you. We'll also have some resources that will be shown in a bit. And so you can definitely jot those websites and links down. 5, I'll take it. I don't need to wear condoms while I'm PrEP. This is also false. While PrEP, if taken once daily and has built protection or prevention, it doesn't prevent against other STIs or sexually transmitted infections. And so it's still important to practice safe sexual decisions, especially with multiple partners, and of course, following up with your physician for more details. Aliyah, 6, if you could take this one, comprehensive sex ed encourages youth to have sex. True or false?
So that is false. Obviously something we hear a lot of, but actually comprehensive sexuality education has shown in numerous studies to actually delay young people's or a person's actual first initial sexual encounter. So, and also reduction of the number of sexual partners as well.
Awesome. So it sounds like it leads to better decision-making on behalf of youth. All good. So we hope everyone enjoyed that activity and reaffirm that knowledge. I would like to take this opportunity to ask for final thoughts from any of our panelists. I know we've learned a lot and covered a lot, but if anyone would like to share any local resources in Upper Manhattan for folks who may be watching to get access to PrEP or to learn more about comprehensive sexuality education, perhaps, and to get into the fight to pass the bill in Albany. This would be a good opportunity to just share with some folks in the audience how they can get involved. Can we come to you first? Aliyah, can we come to you first? Or I think she may.
Okay, because we just showed that my internet was acting a little weird. So I guess for me, final thoughts. I think that we all have talked a lot about medical interventions and ways in which young people, but also just people in general, can be able to get increased access to PrEP. But I think we also have stressed the importance of education. And I think that's really where comprehensive sexuality education really can play a really key role. And I think that that's really important within comprehensive sexuality education, because young people become adults and they really need to be able to have this information about how to protect themselves, how to protect, their partners. I think also shifting away from talking about risk and more so putting the argument or the conversation about protection is a better way to help empower young people, and then also can help reduce the stigma behind deciding to get tested or even to go on PrEP. I think a lot of people utilize or think of PrEP as, oh, you are doing severely high risk behaviors, and it might be the stigma and the shaming that some people might feel, which is why they do not want to go get tested. They don't want to get on PrEP, and that's what a lot of young people face. A lot of times when I'm talking to young people, whether it be when I was doing sexuality education, or now when I talk to them about their right to get in confidential health care, it's a lot how is, someone's gonna judge me? How are they gonna feel about what I'm doing? Or because I'm young, I'm not supposed to be having sex, and all these different things that plays into a young person. And I think also really having the emphasis on how we're going to help young people, because even though adults also have that issue to access and financial barriers, a young person is tenfold, right? They don't know how they're going to get access to these, potentially life-saving interventions and medication. They don't know how they're going to pay for it if they can't utilize their parents' insurance. And so I think education and also kind of shifting the narrative of how we talk about PrEP and how we talk about, HIV in general can actually also help reduce and prevent HIV amongst most populations, but specifically amongst youth populations as well.
And a quick follow-up. Thank you for that. Someone in the audience is asking, what are the biggest roadblocks to getting this passed? You talked a bit about the fear-mongering and folks discussing like straw men about what comprehensive sexuality education look like. Can you discuss others or maybe a bit more about that?
So yeah, I think the biggest thing is the misinformation that people have, these myths about what comprehensive sexuality education does. And also what I think it's also a lot of time people have this issue with like young children learning about comprehensive sexuality education. And because it has sexuality and the word sex in it, they automatically think a kindergartner is going to be learning about sex. And I think that a lot of it is just stressing about education, about like, no, actually what we mean by comprehensive sex ed is this. And then when this bill is passed, it's what the national guidelines and standards for what K-2 is going to learn. It's going to be more so like bodily autonomy, anatomy, right? Grades 3 through 5 is going to be learning something, like certain other ones, but also consent is a huge aspect of comprehensive sexuality education as well. Continue to build upon these roadblocks, or building blocks actually, about consent and healthy relationships. So when we were getting to the conversation about sex and human sexuality and all these different things, when they come to grades 6 through 12, they've already established how to have healthy communication, healthy boundaries, so that it also helps to reduce instances of gender-based violence as well as intimate partner violence as well, and sexual assault, because we already have these building blocks of what consent is. So it stops somebody from possibly becoming a victim of sexual assault, but it could also prevent people from actually being perpetrators of sexual assault as well, because we understand the concept of consent. I think also people just think that parents don't want comprehensive sex ed to be taught in schools, and that's not true. Numerous studies show that a lot of parents are actually for comprehensive sex ed, and I think that it would really be in the most helpful a lot of parents to be more vocal about the fact that they really are in agreement with sex ed and they think their children actually deserve it. I feel like a lot of electeds might have a little bit of apprehension about that. And like I said, I think it really just falls into misinformation. And so us as I'm part of what is called Sex Ed Now New York Coalition, which is really the ones who are really helping to advocate for this bill. And so our goal really is to do a lot of education, educating parents, educating teachers, educating youth about sex ed and what this bill would do to try to garner more support. And I think that's the biggest thing for us, is the misinformation and people just having their own, and everybody can have their own beliefs and biases and thoughts about it, but it's just like, it can't be rooted in incorrect information. If you're like, oh, I just don't like the idea, completely fine. If you're saying, oh, it's because you're going to be teaching my kindergartner this, when that's not the truth, that's when we have a lot of issues. So,
and I think education, like you said, is like the tool to combat that. Amplifying those discussions on every level is important. I want one more opportunity for last thoughts. It's okay if no one has any. We've been learning a lot. I know I have.
I would like to add something. I think education is key, as Aliyah mentioned. Young people, I think once they have the right tools and education, they can advocate for themselves, and they can even go and ask their doctor, I want that. I think the same way there has been so much progress in contraception and offering it to young people, and I think with time, like the stigma of being on oral contraceptive is not as much as it used to be, even though there's still a lot of progress to be made. But I think the same way both the public and the providers think about it, I think this is how we should think about it. And I do put a lot of responsibilities on the providers. I mean, the the adolescent, the pediatrician, the doctors who see adolescent or adult, they have a chance, every time they encounter the patient to talk about sexual history, to talk about substance use history, and to have that discussion about how can we protect you and what can we do. But if we as provider are not taking that, step in, having that conversation, I think it's a lot of it is also on us, in addition to, of course, facilitating, the other resources in the community. But I think once we have the patient in front of us, especially like for pediatric patients, when they come to see their doctor on a regular basis, they should have that discussion. And I am hoping that it took some time for adults. It's gonna take a little time, but I think we're on the right track, and we should continue to work on that.
Thank you for sharing that, Doctor. And I think that is a good point to end this discussion. We've covered a lot. PrEP, dispelled some myths, learned about comprehensive sexuality education, and how the two work hand in hand to combat HIV. I know they're sharing a screen that has local resources on the slide. And so please follow up with anyone in your local community, your primary care physician, community health center, to find out more clinical perspective and follow up on anything that you learned here today. We'll be sending around some further correspondence that'll include some ways you can get involved with getting comprehensive sexuality education passed. And so some helpful tools coming in that regard. This has also been recorded, and so Amida Care, as well as the New Pride Agenda, will be posting it on our websites and sending it around to folks. And so we'll be able to watch this after the fact. I want to, again, name my deep gratitude to everyone on this panel. That is Alister, Aliyah, Dr. Sandling, Dr. Antonios. I learned so much from you all. And it's an honor to be sharing this space for this important discussion. Also, a shout out to Councilmember Mark Levine for joining us at the opening and setting the tone regarding the urgency of this issue. This is a part of a series. This is the third one. We'll be back with our fourth one, either late May or early June. Please stay out for more details. We'll be in Jackson Heights and the Queens, Zooming live from another community. I know Alister and Wiley will be with us. And so we're excited to have you all again. Enjoy your Tuesday. And yeah, everyone take care. Bye-bye.
Thank you.
Thank you.